expectancy. Some of the health disparities experienced by African American men, a cancer mortality rate about 50% higher than white men. Black men are nearly twice as likely to die of a stroke than white men, 2 times as likely to have diabetes, and nearly 6 times as likely to die of AIDS. Eliminating disparities in health outcomes is an important issue and has become a top priority on a state and national level. Are you concerned about your family's health? Then this is the show for you. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me, who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for a special edition of Healthy Connections. Joining us are Larry Williams, the founder and executive director of Simeon Resource and Development Center for Men here in Orlando. He's here to talk about the general health concerns of the Black community and African American men in particular. And Dr. Robert Baker, a board-certified gastroenterologist who's been in practice for 26 years. Gentlemen, thank you for being with us.
Thank you.
Thank you for inviting me.
This show is all about Black men's health. Mr. Williams, your center focuses on health issues related to the Black community, but for African American men in general, what are the biggest problems that you see health-wise?
Right. Well, to look at Black men in general, you have to look at the whole person. And so we look at the social determinants. And when you look at the number of Black men who are uninsured, and without insurance, you can't go to the doctor. A lot of them do not have the educational attainment that they need in order to get the better job, in order to get the insurance. They don't have that as well. So we address the entire man. But what we see in our center is that a disproportionate number of Black men are coming through and we do health education with prostate issues. Also, of course, diabetes, heart disease, and immunization issues in terms of influenza, which can impact you as well. And we also see a lot of them, which the doctor can talk about as well, with oral health, and that can impact you really in terms of heart disease. And so we see a preponderance of issues among these guys.
So what do you do? It almost seems like, here's the elephant. How do we even start? Is taking a bite a good start?
It is. And looking at the social norms as well. A lot of my clients live in communities of concentrated disadvantage, which means that there is a high percentage of them that are unemployed. There's a high poverty level as well. There's a lot of violence in the neighborhood, poor performing schools, and there's a desert when it comes to finding healthy foods. And so we have to talk about all of those issues and get them to take one thing at a time.
So what's the first thing?
I think doing a complete assessment on them to see where they are in terms of their health, in terms of education, and then develop a plan to address those barriers. And
I'm sure you then send them to physicians.
Absolutely.
If they can afford it and if they will go.
Right. And if they cannot afford it, then there are a couple of community health centers that I have working relationships with that I can refer them to.
So let's say they get referred to you, Dr. Baker. You're a gastroenterologist. So first of all, just define for us what that specialty is.
It's the study of the digestive system. So from the time you ingest your food product until your body rids itself of it is called digestion, the ability to take nutrients from what you eat.
So in your practice, you deal with people who perhaps contract colorectal cancer.
Absolutely.
If you look at the numbers, is there a disproportionate number of Black men who have colorectal cancer as compared to the white men or the general population?
Yes. Black men are overrepresented when it comes to colorectal cancer. We're the #1 group. when we look at the incidence of colorectal cancer
Why
in this
is
country.
that?
It probably has a lot to do with genetic factors. It has to do with diet. It has to do with sedentary lifestyle. And certainly smoking, which we tend to see in a maybe in higher proportion in our population. Alcohol consumption is a risk factor. But age, diet, and sedentary lifestyle and obesity are the major risk factors for colon cancer.
So what is the best screening methodology?
The gold standard is colonoscopy. It's basically taking a long, flexible tube with a camera and a light and use that to examine all 6 feet of the large intestine. There's
Now
no
that
doubt.
does not sound like a day at the park for anybody.
Well, actually, you know, and that's one of the myths of colonoscopy,
Okay,
that
let's
it's
talk about
painful.
that.
Well, it's not. It's done with sedation.
So you're knocked out.
You're knocked out.
Okay.
It takes 15 minutes to do the procedure, and it has been shown because of these screening procedures, the incidence of colon cancer deaths in America is declining. We can expect 140,000 people to be diagnosed with colorectal cancer in this country this year. It's the second leading cause of death from cancer
Is
in
that
both men and women.
because people wait until it's too late?
Right, and that's another myth. Another myth is that if I feel good, I cannot possibly have cancer, and that's not true. That's not true. It's a silent killer.
Do you see that at your center, that people come in when it's almost at the 11th hour?
Right. I do, Annette, and also I can say to you in terms of the socialization of men or males in our society, you know, even as a young boy, if you fall down, you're told to be a big boy, get up and don't
Suck
cry.
it up,
Suck
don't
it
cry,
up, don't
right.
cry. And so we learn not to express what we feel. Seriously, we learn not to physically or emotionally, we learn not to express what we feel. I had a client that called me about 3 months ago and he said, Larry, I can't breathe. He was home dying. And he had gotten so ill and I had to pick him up and take him to the emergency room.
So what would both of you say to the men who are watching and their partners who have been begging, pleading, you know, bribing, whatever it is to get them to the doctor? What would you say to those men?
Absolutely go in, and I can say that Dr. Baker has performed both of my colonoscopies, and that you don't feel anything. I mean, you're knocked out. I can remember being in the procedure room, and I was getting dizzy, and then I woke up, and he was there to tell me.
Everything's done,
Yeah,
okay.
Yeah, and so it's painless, but get it done. And not to think about yourself, but think about the people around you, your children who need you here. So you need to get in and do it for them, if not for yourself.
Dr. Baker?
Yeah, you have to take charge of your health. And one way of doing that is being knowledgeable about screening procedures when they're required. In African Americans, a screening colonoscopy is recommended for everyone 45 and older. It is not based on symptoms. As I said before, you probably will not have any symptoms. But if the greatest chance or your greatest benefit or your ability to decrease your chance of getting colon cancer is to have a screening colonoscopy.
Because by the time you have the symptoms, the blood in the stool, it's progressed to a point where you get concerned. And
that gets into staging. That's exactly right. Diagnosed early, your survival rate at 5 years is 95% or more. Diagnosed late, when you see blood in the stool, or if you have abdominal pain or a bowel obstruction, your survival rate is 10% or less for 5 years.
I don't think anything else needs to be said after that. And once you have a colonoscopy, there's a long period of time before you need another one. Is
That's
that correct?
right. It's recommended every 10 years, unless you have a family history. There are some risk factors. If you have a family member, a close family member that had colon cancer, you should get a colonoscopy every 5 years.
But still, that's a small price to pay
Absolutely.
to be around for the people who love you and need you.
That's right.
So get your egos out of the way and get into see Mr. Williams or Dr. Baker. Gentlemen, thank you.
Thank you.
Thank you so much.
We're not done. Stay with us. Joining us now are Dr. Abraham Woods, who has practiced urology in the Central Florida area for about 30 years. He's a former member of the Florida Board of Medicine and is known for active surveillance for prostate cancer with a national following over 14 years. And Dr. David Robinson. He is medical director at Florida Hospital Cancer Institute, a physician at Premier Hematology and Oncology, and serves as a volunteer faculty member at the UCF College of Medicine. He's also board certified in internal medicine and medical oncology. Gentlemen, thank you for being here. I don't know when you sleep between all of that, but today we're going to talk about something unique to men, which is the prostate and prostate cancer. First of all, Dr. Woods, what is the medical specialty of urology?
Urology is a surgical specialty where we're trained to take care of conditions related to kidney, bladder, prostate, reproductive organ systems. Most people would know us by taking care of kidney stones, taking care of kidney cancers, bladder cancers, prostate cancers, and then the other way people would know us is because of erectile dysfunction, which is something that happens in men. We're the ones that take care of that and then put in prosthetic devices for that. And early on in childhood, we may be that doctor that helped with sex of undetermined, or where you're trying to determine what sex that child should be raised. We're the doctors that may make that type of surgical correction to either raise the child as a male or female.
Okay, so for today's purposes, we're talking about African American men and their health. Do you see a disproportionate number of men in your practice, African American men, who come to you for prostate issues that could have been taken care of if there had been a little bit of prevention on the front end?
Oh, definitely.
So what would you say to those men who don't want to come see you, who don't want to bend over and cough?
I can change your life.
Okay.
And thanks for coming today. And this is what I would do. You basically want to get into the mindset as to what is the fear has kept him from coming to the practice.
What do you see as the biggest fear?
Well, in healthcare, there's a lot of issues. Men always quote and remember the Tuskegee event and what happened to men that volunteered for studies. But one of the things that you talk about in the barbershop, men talk about is, you know, Johnny, erections. Anything that may affect erections, they don't want to deal with it. One of the most common things you hear of today is the results of prostate cancer treatment. And so with surgeries, we can't guarantee that we can spare Johnny. We make a good effort to. But when the barbershop conversations get in the communities, men say, oh no, I'm not going to have that done because I may lose Johnny. And so that fear has to be overcome.
Okay. And by the time they get to you, Dr. Robinson, is it often a case of it's a little too late?
Yes. As a medical oncologist, I treat patients who have been diagnosed with cancer. So by the time a patient comes to see me, they've already been diagnosed with cancer, and we're talking about what are our possible treatment options from that point.
And what can you say to them to give them hope if they have not gone to see Dr. Woods in a timely fashion?
I mean, the treatment for prostate cancer really depends upon the stage of disease at which it's found. So men who present with early prostate cancer are presented with several options. They could range from active surveillance, which Dr. Woods is very good at. It could also range from surgery to remove the prostate or radiation therapy or a combination of the two.
Active surveillance, what is that?
Active surveillance is a process of doing something active to change the body and change yourself as to how you end up with the cancer. And what that means is that from research and from theory, we know that man becomes what he is by what he takes in. And so, therefore, if we can reverse that process, number one, with the mouth, with eating, nutrition, with his thought process, with habits of activity, with removing the fear tactics, because we know from research from Vienna, Dr. Selye, stress causes a lot of things to be magnified within the body, especially with cancer. So the thing about active surveillance is that it's a process of education, serious education, far greater than a surgical procedure, far greater than radiation, because the outcome is something totally different than just a treatment for prostate cancer.
Once the
we
problem
end up
is
treating
presented.
the entire person, that all of a sudden a lot of other medical problems begin to go away.
So, Dr. Robinson, as a cancer specialist, how do you feel, or what's your opinion about the connection between stress or the psyche and emotions and cancer? Because we're hearing a lot about the connection between stress and disease.
There is a huge connection between stress and disease. But let me first back up Dr. Wood's proposition for surveillance. What's the most appropriate treatment for those men so they can enjoy a vibrant and full life without having to deal with issues of incontinence or impotence?
And what is that?
That's the conversation.
Okay.
That's
Yes,
the
yes.
hard
Great conversation.
conversation where you have to
Yes.
sit down and try to explain these things. And I can tell you, when I meet men for the very first time, their emotions, they're sky high. They want something done. Men are men. I want it out.
Okay.
And I'm sitting here trying to tell you, well, let's think about what our options are. No, you tell me I have cancer. I want this cancer out. It's
So
a-
they jump to the
Oh,
extreme.
absolutely.
Okay.
If it's gone, we're done.
And you say, let's look at a more holistic approach.
I'm a board certified surgeon. Let's not get that wrong. And I love prostate surgery. But having to listen to the patients asking for choice, I had to be taught that the natural history of this disease was not the killer that I was trained to believe that it was. In my early days of surgery, everybody with the cancer, whether it was low grade, whatever, you're getting that prostate out because it's going to kill you.
Okay.
But let me tell you, after I've been in active surveillance for over 14 years, I have men with prostate cancer that started low grade. Today, they don't have the cancer. We biopsy the prostate, do the PSAs. They're all normal. And the thing that has convinced me is that intent. You become what you are because of intent. And therefore, as these men work through the process of reconditioning, because cancer is actually normal cells gone bad. And therefore, something happened within the body, whether we ate something, exposed ourselves to something, the stress, whatever, caused free radicals to just eat us up inside, and all of a sudden, we have this disease process. Instead of jumping on a quick fix American habit of how we do things, let's go holistically and look at the body. If that's attacking the prostate, imagine what's happening with the rest of the body.
So you're looking at the whole life of the man, not just one part of him.
The whole life.
And Dr. Robinson, if you had one last piece of advice for men who are listening, what would you say?
Take charge of your health. Don't leave it up to your wife. She loves you. She's going to be looking out for you, but you also have to be responsible as well.
Okay, I think that is a
love it.
great place to
Yes,
leave off.
yes.
Okay, thank you, doctors. We will be back right after this. You think that was good? Joining us now is Dr. Jamal A. McLeod, Medical Director of Zenith Wellness, an integrative medical practice located in Central Florida. Zenith Wellness combines conventional medical therapies as well as complementary therapies that have been subject to rigorous scientific inquiry. And joining him is Dr. John Robertson. He's a licensed psychologist in private practice and is the executive director of a nonprofit, the Multicultural Addictions Network, Incorporated. Gentlemen, thank you both for being with us today.
Thank you for having me.
Dr. McLeod, what is integrative medicine?
Well, mainly it's lifestyle medicine. It addresses the body, the mind, and the spirit. Takes the best of conventional medicine, your normal MDs and DOs, along with complementary medicine, alternative type of lifestyle medicine. It combines both, and it takes the best from both worlds that's evidence-based.
Okay, we're familiar with traditional medicine, but when you say lifestyle medicine, what does that look like in terms of what you help people with?
First off, environmental issues. We all have our own story. We're born in a certain area. We're exposed to different things in lifestyle. We might have exercise habits. We might have different other lifestyle habits. So it looks at that. It also looks at the genetics. It also looks at it from a cultural standpoint in terms of your story, where you've come from, where your family comes from. All that has impacts on a person's health and well-being.
Now, as it relates to African American men, you mentioned the cultural impact. In terms of your practice, what are some of the things that you see most often that you are helping African American men with in terms of improving their quality of life and health?
Mainly chronic disease. We look at metabolic syndrome, that's the step before diabetes. We look at diabetes. We look at chronic resistive hypertension. That's hypertension that the numbers are extremely high and resistant to a lot of medications. We look at hyperlipidemia or elevated cholesterol. We're looking at prostate issues, colon issues, various types of cancer. Those are the main.
So are your patients usually referred to you by their primary care physician? Are you finding that people are a little more savvy now? You're the first stop because you do a little bit of everything.
A little bit of both. Primary cares, I know various primary cares around the Orlando, Central Florida area. A lot of times they do not get results with certain patients with the traditional pharmaceuticals. So I'm the next step in terms of looking at their lifestyle, their diet, their exercise patterns, their genetics. We do what's called functional blood analysis, where we look at traditional labs. Conventional medicine is very, very good at looking at trauma, addressing trauma. But when it comes to chronic conditions that have built over a long period of time, it doesn't look at the cause. I try to get to the cause of the matter, and that's what will help to actually cause prevention, and in a lot of cases, remove them from a lot of diseases.
So you're not looking at the leaves of the tree, you're looking at the root.
Exactly.
Okay. And speaking of root, Dr. Robertson, some of those issues that are particular to African Americans and African American men in general, in terms of their health, are psychological. How often do African American folks and black men in general seek help for things that are not physical? And what would you say to someone who may say, I'm not going to let anybody get inside my head?
I encountered that quite a bit. Often African American men will come to psychological services through experiencing stress. It may be stress from work-related kind of situations, maybe stress from familial relationships, from having gotten into some problems, with their physical health. But often they'll say, well, there's nothing wrong with me. I just need to talk with someone. And I find out that in talking with them, that often many things that they've taken for granted, that other individuals may have crumbled under the kind of stresses that they're under, that these men have experienced that kind of stress for years.
What kinds of things are we talking about?
Will be such things as depression, anxiety, and often I see a lot of sleep problems. Many of the symptoms often show up as physical symptoms initially, and then as you explore history, it turns out that many of these things may stem from earlier traumas that they've suffered, from a variety of, at times, socioeconomic problems, as in growing up with a sense of not knowing where where their security is coming from, and so living with often a low-grade kind of stress throughout life. And in sitting down and talking with them, I find that often they're surprised when they find out that first, that they're not quote unquote crazy.
Okay.
Because often that's one of the fears that many African American men who see a psychologist or psychiatrist or any kind of mental health provider may feel that if I go in and talk with them, they're going to find out some deep, dark, undiscovered problem that they have.
And you're saying it's more common than you realize, and you're not alone.
Exactly.
And Dr. McLeod, I saw you nodding your head when Dr. Robertson was talking about the connection between stress and health. So what would you say to men who are out there who have come to you and have these severe physical problems, but may need to talk to somebody like Dr. Robertson?
Psychological counseling is the cornerstone of what we do. I think that every person needs to have a person in their life that is not directly related to them, that they could discuss a lot of their issues. Also, a lot of my patients, my stress, different things, is guided meditation. There's a lot of research that's based on that in terms of helping to relax a person and calm down a lot of issues that will manifest, such as hypertension.
So you truly take an holistic approach.
Exactly.
And Dr. Robertson, final words to a man who's watching and going, well, maybe I do need to talk to someone. What would you say?
I would say definitely talk to someone who you trust. Many of our African American men will want to talk to a pastor, and that's a good thing. But many pastors are just not prepared to deal with some of the ongoing and deeper lying issues that many African American men have. The other option would be find a mental health professional that you feel comfortable with, that you feel may understand, your life circumstance, your culture, where you come from.
But both of you are saying, don't try to do this on your own.
Exactly.
There's no honor in trying to be the lone ranger, the lone warrior out there.
Exactly.
And it could damage your health or worse.
Right. Could cost you your health.
Doctors, thank you very much.
Thank
Thank you.
We will be back right after this. Don't go away. We are all human beings, basically the same. But for African American men, there are some unique health issues that need special attention. And what we try to do in this show today is to make sure that we look at prevention, look at what goes in the body, and to get help for those stressors that just come from everyday living. If you have an African American man in your life, make sure he's around to enjoy more healthy connections. I'm Annetta Wilson. We'll see you next time.